Hi folks, today I want to talk about how we can use the spirometers to diagnose pulmonary diseases, whether they're obstructive diseases or restrictive diseases, and what exactly that means when we have a patient who is suffering from those things. So here I have a graph of some spirometer data. It's a little bit different than what we've been doing in class. In this case, I've asked the patient to exhale as quickly as possible, as maximally as possible. Get as much air out as fast as they can. And by doing so, there are two values that we can look at. There is the forced expiratory volume in 1 second, aka the FEV1, and that is the volume exhaled in the first second after a deep inspiration, deep breath in, and a forced expiration, all the air coming out at the same time. And you can see that value is 1 second into the graph. We just find that volume right there. The next value we can use when we're doing diagnostics is the forced vital capacity, and that is the total volume of air that the patient can forcibly exhale in one breath. Just like vital capacity, where we're trying to breathe out as much as possible, this just happens to be different because of that word right there, forcibly. We want the patient to be able to breathe as quickly as possible all at the same time. Now, normal FEV1 values are going to tell us that the airways are unobstructed, meaning that there's nothing in the trachea, bronchi, or bronchioles. And some normal values for males are 3.5 to 4.5 liters, whereas females will have a smaller FEV1 of about 2.5 to 3.25. Here I have a female patient who gave us a better than normal FEV1. That's totally fine, nothing wrong with better than normal. A normal FVC, on the other hand, a normal forced vital capacity, tells us that the lungs are functioning well, meaning that there's nothing restricting how much those lungs can open and close and how much air they can actually take in. A normal FVC for males is somewhere between 4 3/4 and 5.5 liters, and a normal FVC for females is somewhere between 3 1/4 and 3 3/4 liters. This patient right here has a forced vital capacity of 4. That is totally fine. Again, they're female. This is normal. It's okay to have above that normal range. However, sometimes you'll have patients that are a little bit abnormal, and I want to show you one example here in red. Notice that when I asked this patient to breathe out as quickly as possible, they had a hard time getting as much air as they should out of their lungs, and they had a hard time getting a lot of it out in 1 second. Something is restricting their airflow. If you take those values and approximate them for about 3.2 and 2, clearly these are not the normal ranges for an everyday female. What this would indicate is called restrictive lung disease, a class of diseases where the lungs are not able to inflate or deflate as quickly as they should. We get them from seeing a reduced FEV1, which would be less than 80% of a predicted normal value. So our predicted normal value for this patient would have been 3.5. Well, if they only scored a 2, let's do the math. 80% of 3.5 is definitely not 2. And a reduced FVC, forced vital capacity, less than 80% predicted normal. Our normal here was 4. Well, 80% of 4 is right on the money, 3.2. So this would indicate that the lungs are reduced in the usable volume and they're not getting as much air into them as they need. You can see some common causes for this, whether it's pulmonary conditions causing this, like pulmonary fibrosis or pulmonary edema. These are both things that restrict the amount of air that can actually get into the lungs, whether the lungs are hardened through fibrosis or whether they have bubbles in them through edema, or lung tumors being in the way. That could also cause a restrictive lung condition. But you can also see that there are non-pulmonary causes, as in if there's a skeletal abnormality in the rib cage that causes that area around the lungs to not be able to be movable or not have as much volume, then of course the lungs aren't going to be able to move as much. Same for neuromuscular diseases like cystic fibrosis. Same for obesity. If I have a bunch of weight on my chest, I'm not going to be able to move my lungs as much. And even pregnancy, if you have a child inside your uterus and it's pushing on the diaphragm, the diaphragm is not able to move enough, yeah, that could cause some restrictive lung problems. Now here I have a different patient, same normal values of what we predict should be of 3.5 for FEV1 and 4 for FVC. I have a different patient, and it looks like they get pretty close to the normal value for FVC, but their FEV1 is way, way down here. The slope that leads to the FVC indicates that this patient is not able to force enough volume of air out in 1 second, or even 2 seconds or 3 seconds, to show that they are not able to get that air out of the lungs. They have the air, but they can't get it out. In fact, the values that we calculate or estimate for this one, I have an FVC of 3.6 and an FEV1 of all the way down to 1.2 liters. That is not a lot of air being able to exit out of the body, and that person would have to breathe really heavy in order to be able to get that air out of their lungs. Not a good situation, folks. And this would indicate obstructive lung disease, meaning that something is in the way. Lungs are absolutely fine, but the airways have some obstruction, reducing the airflow through the lungs to prevent that air from getting out, or in this case, getting in as well. We can do this very simply with a little bit of arithmetic, because we can actually compare the FEV1, which is less than 80% of the predicted normal, so we know there's a problem, to the FVC, which is rather close. It's somewhat reduced, but rather close, within 10% of the normal value. It's 90% good. But notice if I compare these two values using a ratio of FEV1 divided by FVC, if I use these two values, the 1.2 and the 3.6, and I divide them out, then I should, if I'm healthy, get a value above 0.7, and clearly 1.2 divided by 3.6 is nowhere near 0.7. So this person is not functioning because they cannot get the air through their airways. The lungs are totally fine, but the airways are the problem. Some common obstructive lung diseases include COPD, which is related to individuals who smoke all their lives and they end up with plaques in those airways, reducing the ability for those airways to expand and contract when they need to. Asthma is an obstructive lung disease that you're going to investigate further, so I'm not going to spoil it for you here. And cystic fibrosis is a genetic disorder where individuals create a lot of mucus in their airways, restricting the ability for the air to flow through. It's kind of like shrinking a hose, a garden hose, reducing the ability for that garden hose to be able to flow. That's it for me. Good luck on the next activity.